It's healthy seniorhood. Aging doesn't have to be a disease all the time. Aging is normal. We want to age healthy. And if aging becomes unhealthy, there's a lot of things that we can still do to make that animal's quality of life much better.
Hey everyone, thanks for tuning in. Thrilled to have you here. This episode is sponsored by Hills and features Dr. Leticia Fanucci, here to talk about a topic that's becoming increasingly more important in veterinary medicine: canine cognitive decline. Thanks to so many advances in preventative care and treatment options for common conditions, our furry friends are living longer and longer lives, which of course is a blessing, but because of that, we're now starting to identify more conditions specific to geriatric pets. And as I said before, in this episode, we're focusing on canine cognitive dysfunction, which is a condition that can take a major toll on our patients' quality of life as well as the quality of life of their families. Dr. Fanucci and I talked about ways to spot the more subtle signs of canine cognitive dysfunction, tools we can use to help identify it early, and the physical changes that are happening in the brain during this process. We also talked about strategies to help slow cognitive decline, including the critical role of antioxidants in the diet of aging pets, as well as the importance of keeping aging dogs active and engaged throughout their entire lives, and the role that anxiety and behavioral changes play in cognitive decline. It's such an important topic when it comes to aging pets, and Dr. Fanucci offered so much practical insight into how we can work with clients to help our pets age happily and gracefully. Let me tell you a little bit about her and we'll get into our episode. Dr. Leticia Fanucci is a clinical assistant professor in the Department of Veterinary Clinical Sciences at Oklahoma State University. She holds both a DVM degree as well as a PhD, and her specialty is animal behavior. Originally from Ponta Grossa, Paraná in Brazil, Dr. Fanucci earned her DVM degree from the Universidade Toyuchi do Paraná in Brazil. Her research interests are applied behavior and animal well-being. And this is an incredibly overly humble and short bio. If you like this episode, I highly recommend reading some of the papers Dr. Fanucci has published. Really interesting research. But in the meantime, let's go ahead and get into our episode.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official Human-Animal Bond certification from NAVC and HABRI, the Human-Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at vetfolio.com.
I'm joined by Dr. Leticia Fanucci, and we're going to talk about canine cognitive decline. Gosh, I feel like this is a topic that we could probably spend all day on, and it probably doesn't get enough attention. So, Dr. Fanucci, thank you so much for joining me.
Thank you for having me. It's a pleasure to be here and to share a little bit about this condition in dogs.
Absolutely. I'm excited to dive into it. So, thinking of, canine cognitive dysfunction or canine cognitive decline, I guess my first question would be, what types of factors contribute to cognitive dysfunction? I could probably make an educated guess, but I don't know if I really have, like a solid foundation of what really causes and contributes to cognitive decline, maybe from a health standpoint, from an environmental standpoint, from a physiologic standpoint. What sort of factors are we looking at?
Right. So we have a lot of data from the human side of things, right? We don't have the same amount of research that we would like to have in dogs and much less in cats. But the factors that we think play a role, and there's several factors. So there is not a one, it's not one thing that causes it or contributes to it, but probably a combination of several factors. Lifestyle. So dogs that have a more enriched lifestyle are probably less likely to have early onset of the disease. Of course, animals that live long enough are more prone to having it because, the top killers are going to be heart disease, kidney disease, and cancer. And if they survive all three and they live long enough, they're going to probably have some cognitive decline. Probably diet plays a role in it as well, even though dogs have a more balanced diet these days because of the commercial formulas available. There are probably certain ingredients in the formula that we can, start offering earlier in their, early aging process that would probably contribute to better oxygenation, better antioxidant activity in the brain tissue. But there are certain metabolic disorders that can contribute to the onset of the disease, such as diabetes and some like, endocrine disorders probably. And then anxiety disorders that are untreated during that, early life or mid-adult life, if left untreated, can contribute to early onset of cognitive decline. So there's probably a lot of things that play a role, but we don't know which one is more or less likely to be the, contributor to it.
Sure. And I think some of that certainly makes sense, especially like you said, carrying over from the human side, thinking about a more enriched lifestyle and treating anxiety disorders early seems kind of akin to managing stress in ourselves and how that can really contribute to health issues down the road. I'm curious to know, is there any information about the impact of, say, hearing loss or vision loss on cognitive decline? I mean, I know you mentioned diabetes. I don't know if the cataracts are involved in that cognitive decline or if it's other physiological processes.
So it's cataracts can certainly contribute to that because it's going to just, decrease visual acuity. But the inability to process glucose effectively is probably the main factor in type 2 diabetes. So the brain gets less competent at metabolizing glucose or using glucose as the main source of energy. And that's why, it's important to have, we're going to talk about diet probably in a little bit. What ingredients in the diet can actually counter that effect or can help, compensate for that lack or decreased utilization of glucose by the brain tissue.
Yeah, I want to dive into diet for sure and say, oh, well, if the brain's not using glucose, what is it using? But I
Right.
know we're gonna go there. So kind of on our journey here while we're making our way there, kind of screening and watching for cognitive decline in our patients. I mean, oftentimes there's already an impact on quality of life. And, we're seeing things like they're waking the owners up at night. And are there steps we can take to really keep an eye out for early signs of cognitive decline? I know you mentioned with diet, offering some of these nutrients earlier and so, thinking if we can kind of screen for that and watch for it, maybe we would have that opportunity.
Yeah, so, one of the things that we want to understand first is what kind of impairments are we talking about in cognitive decline, right? So we normally have impairments in memory, in learning, in perception, and awareness. So those are the main areas where we're going to see some impairment. And then that kind of impairment is going to lead to a variety of signs that are more related to confusion around the environment, altered social relationships. You're going to see changes in activity levels. Some dogs are going to be more depressed or act more lethargic, more apathetic. Some will actually be the opposite of that. They're going to show increased anxiety, especially those that were anxious before but never had that addressed or treated. And you're going to see changes in sleep-wake cycles. So those are all the signs that are normally the first ones presenting cognitive decline. Now, what we need to remember is that a lot of these signs are part of aging processes. So, what is a healthy aging process versus a not so healthy one, such as, cognitive decline that is actually impairing the animal's quality of life? So, that's where we need to draw a line, and that line is not very, it's a little blurry. It's not an easy to see line. Of course, with aging, we're going to see impairments such as sensory. So they're going to have decreased hearing, decreased vision, and that is expected already as part of normal aging. But can those things affect them to the point that they can become more cognitively impaired? The answer is probably yes, because they're reacting or interacting less with the environment. So these are animals that are less stimulated. Their lives and their daily lives are less enriched. They're not taking advantage of enrichments because they just don't interact with them anymore. They don't get taken outside often enough. They don't get to see daylight and sun exposure often enough, and that can affect the way they sleep at night, can affect pineal gland. So yes, there is normal aging, but normal aging aging doesn't mean we're going to just let that dog sleep 12 hours a day. And just because it's an old dog now, we don't have to take them on walks or play with them or do some training, offer puzzle toys, take them on parks or on strollers. I mean, there's several things we should be doing with them, adapting to their aging conditions, but still offering them that kind of stimulation versus just treating them as old dogs that don't really need much because they just don't do much anymore.
It always makes my eye twitch a little bit when I'm in an exam room with, with an owner and you say, "Oh, how do you feel like they're doing at home? How are things going?" And, "Oh, they're going fine. They sleep a lot now because they're older or they don't really, want to go on walks or do the things that they used to, but they're old." And my eye twitches a little bit because I'm like, "Are they?" Because I think there's probably more to it than just they're old.
Yes.
And then I always have to like gear up for this this like long conversation. I'm like, do I have time for this right now?
Right, exactly.
Uh, so, using that kind of as an example of, oh, this dog is getting older, or maybe we have a more severe case where they are waking the owner up at night, barking or getting lost in the house, showing, uncontrolled anxiety or something like that. Um, What sort of diagnostics should we consider in those cases? I mean, truthfully, there's nothing specific that comes into my mind as far as, running this test to help diagnose cognitive decline, but am I on the right track there?
Yes. So a couple of the things that can be done. So there we have some data on, diagnostic tools. Some of the data is actually at the research level only. We're not using that as a clinical tool right now, but we do need a full behavior assessment of this pet, right? And so let's talk about a behavior assessment of cognitive decline first, because that's the one that all of us can do on a regular basis with our aging patients. We want to identify changes that happened recently. I want to say recently, by that I mean in the last year, maybe, or year or 2 years. So things that are significantly different now. So it doesn't matter if the pet, oh, he's house soils, he pees in the living room, but has he always done that? Or this is a new thing now. So soiling suddenly started to be a thing. And now we have an animal that is 12 years old, never soiled before. So is it fair to say that now this animal is naughty? Oh, he's a grumpy old man. That's why he's peeing in the living room. Or he's mad because I left him alone to go to the store and now he's doing. So, and all those human interpretations don't help us very much and probably are not correct. So we want to identify changes. Now suddenly they start acting like puppies and they vocalize or they want to play at 3 o'clock in the morning or they're getting stuck around the house. They fall down the stairs to the basement. So changes is in behavior, significant change in behavior is what we want to identify. And that's when those, assessments, those sets of questions that we have created will help the owner identify those changes. And if they are significant enough, they're going to notice and they're going to be able to report that. And depending on the score that we get from those assessments, we're going to be able to see if this is a mild impairment or if this is significant. And this is when we need to start treating more or less aggressively. So that is available to all of us. We now have this, new assessment with hills that the owners can do at home that we can hand to them and they can do a real quick in 10 minutes in the room. And now we have some data on how this pet is aging, right? And what kinds of changes it's showing. Now, still available for us today is some imaging. So yes, we can do imaging and we're talking about MRIs. So in the MRI, what are we going to see in most of these old brains? What are the changes we're going to see? We're going to see cerebrocortical and basal ganglia atrophy, so tissue atrophy. That's normal. That's expected with a senior brain. We're going to see increased ventricular size. We're going to see narrowed gyri. We're going to see widened sulci. So these are changes that we can appreciate in an old brain, but that doesn't mean necessarily that that's a diagnosis of cognitive dysfunction, right? However, there is one technique that we can use that is consistent with the disease, which is the measurement of the interthalamic adhesion thickness. So that little area in the brain, when it's actually atrophied enough or significantly, it's going to have a number. So 5 millimeters or less is consistent with a diagnosis of cognitive dysfunction. So that is a tool that we want to utilize because not only the MRI is going to help us figure out if this is a cognitively impaired brain to the point that I need to treat now, but it will also rule out tumors cortical tumors that can contribute to behavior changes that we are assuming is cognitive decline or anxiety or something else, but it's actually a tumor causing that. So if we can, we want to do imaging in an old brain because yes, that's when they can have tumors. But if we rule that out, then we can actually see how that brain looks in the magnet and what kind of changes we can appreciate now. And if that measurement is of values of 5 millimeters or less, then now we are consistent with the diagnosis paired with the assessment, of course, that we do with the client during the exam. Now, the third one is more at the research level. We have the data, but it's not available as a clinical or diagnostic tool right now, which is neuromarkers, blood markers, actually. So we have that available in humans. It's been done now for at least 10 years. It's available, but for dogs, the research is recent. And we don't have like IDEX or Antec or none of these big labs doing this assessment for us. But that's technically a blood sample that we can submit and then look at certain components in the blood. So the three main ones that we know of in dogs are the NFL, or it's the neurofilament light chain. That's what we call it, NFL. So that's the cytoskeletal protein that helps support the shape and function of the neurons. So it comprises about 85% of the neuronal structure proteins. So when we see a lot of accumulation of an NFL in the blood, that means a lot of those cells are broken down. Those neurons are dying. They're destroyed already. And we're seeing enough of that structure in the blood, then that seems to be consistent with cognitive decline, as well as the phosphorylated tau protein. So the tau protein maintains the stability of the microtubules in the axons. So when we see a lot of them in the blood, they shouldn't be in the blood, should be in the brain and in the neuron, right, in the axon. But if we see them in the blood, that means there's a lot of breakage of these cells, and we're identifying them in the bloodstream now. The other component that is very well known in human medicine is the alpha beta amyloid. So, alpha beta amyloid is the one related to Alzheimer's disease in humans. And those amyloid plaques we know are toxic to the neuronal tissue. Accumulation of those plaques cause death of the neurons at the site of the accumulation. So there's like ischemic events and aging processes that promote the accumulation of beta amyloid plaques, which is very toxic to the brain tissue. Now, this is at the research right now. Hopefully soon, IDEX or Antec, one of these big labs will have that available for us. We just submit a blood sample and we get a result that helps us, come up with the conclusive diagnosis of cognitive decline.
Oh, that would be cool to be able to really provide some guidance for owners in a certain direction with these blood markers, something that's relatively non-invasive and really, kind of gives us a really nice picture there. And I feel a little silly not really recognizing this until we had this conversation. But with what you're describing on the MRI, this atrophy of this area of the brain, for some reason in my head, I'm picturing cognitive decline as, a chemical process more so with like the blood markers that we're talking
Mhm.
about and
Mhm.
and these types of things. But there's a physical atrophy involved in the brain as well. So this is not just correcting any sort of, chemical imbalance, I guess, for lack of a better word. There is a physical loss of mass within the brain.
Yes, correct. And certain areas are more likely to show depending on what type of cognitive process we're talking about. Unfortunately, in dogs, we don't have the same classifications for cognitive decline as we have in people. I mean, there's like at least 100 types of dementia in people that are recognized today, and each one has a different pathophysiology. In dogs, we only know pretty much about four different types that have been described in the literature. It doesn't really matter as far as treatment because the treatment is going to be the same for all of them. But we don't have, I mean, I wish we had stronger, data or more evidence on what exactly happens in the dog and the cat brain. I mean, much less on the cat brain at this point. We have data. But yes, we do know that hippocampus, for example, an area that is responsible for consolidating memory, is one of the big ones that's going to be atrophy. So you're going to see a lot of loss of tissue in the area. And that's when we have like memory impairment. So if you look at the data in humans, People, humans with Alzheimer's disease, they have a hard time remembering things that happened recently. So they have long-term memory more intact, but short-term memory is actively impaired. So those are brains that have a hard time consolidating memory. So they remember things that happened 40 years ago, but they don't remember what they just ate for breakfast. Right. So I don't know that we can have that kind of access in dogs because what's long-term memory versus short-term? But what we see in dogs is that, well, they forgot where they sleep or where they pee or where they, defecate. So they start forgetting things. They forget commands. So things that they knew before, they seem to not remember anymore. They act confused in the house, or they look at an object in the house and act spooked. Like, what is this chair doing here? Well, that chair has always been there, but suddenly it seems to be a novel object in that pet's life. So we do think that they also lose some of their memory, but we just don't know at what level and what is short term versus long term for dogs compared to people, right? So there's a lot of things that we actually don't know yet.
This will be really interesting to watch this as this area of research develops over time. And I'm gonna have to pull in some of my own personal self-discipline here because I feel like I could spend all day just asking more and more questions about this topic alone. But one more point of clarification. You mentioned behavioral assessments and questionnaires, and you said one in particular from Hills, which I'm glad that you said that because I was going to ask you, are there any particular questionnaires, behavioral assessments that you recommend using in these cases?
Yeah, so we can definitely use the one that, we just work together to develop and give that to the client on a regular basis as soon as the pet starts aging. And that should be just part of our normal soap, right? Or their annual visit for, senior visit. So they get their vaccines, they get their senior profile, and then they fill out that assessment. And then the owner can have that at home, easily accessible. And if they start noticing changes, they can actually record those changes. Now, there are validated scales out there that have been researched before and will actually give you a definitive diagnosis. There's two that are validated, the CADIS and the RCAD scale. So those are some scales that the clinician can actually use for a more formal assessment of cognitive decline and pair that with the one that the client brings from home. But the owners should be using those scales, especially the one that we developed with Hills, those ones as a normal aging assessment. So every 6 months, I would recommend the owners to actually do that at home because that's an easy one for the client. It's the language and the wording is more for the client to use. It doesn't really necessarily have to be by the clinician. The client can do it at home. The validated scales, the CADIS is pretty easy to use, but the RCAD one is not supposed to be done by the client at home. That has to be applied by the clinician because you need to know how to word those questions and how to work with the scoring system. But it's not free. So not everybody's going to use the RCAD because you have to buy the copyrights by buying the book in order to use that scale. The CADIS is available online and anyone can use that for free.
I see, I see. And that makes sense to pair the two together to one, get a better assessment of your patient. But I would imagine the client filling out this questionnaire at home also really helps facilitate that conversation in the exam room.
Absolutely.
And you mentioned earlier intervention with cognitive decline and perhaps incorporating some of these scales and questionnaires in order to get a better picture of the cognitive health of our patients earlier and be able to intervene if we're starting to see some compromise. What would early intervention for cognitive decline look like?
So if we wanted to, start working on preventing the early onset, or at least if the animal is prone to have it, at least we can delay the onset a little bit, we think, right? Because we don't have data that actually supports this statement. So, but that's what I think makes sense. If we want to delay that process, we need to make sure that we continue to enrich their environments, that we continue to take them on walks, that we don't give up on the pet just because now it's old and it's not doesn't want to go too far. Or we used to walk 3 miles before every day. Now my dog can only walk 1 block. Well, we walk 1 block if that's all we can do, right? And we go slow. We're not running marathons and we're not counting steps. We're just taking them outside and give them enrichment, exposure to the outside, ability to use their noses and smell different scents, because that's what keeps a brain very active. It's like solving puzzles for them, right? They love to go out and sniff other scents and follow like a scent cone. And it's like going shopping for dogs. So we want to continue to enrich their lives. We want to continue with training. Yes, and no dog can learn a new trick. Yes, no, they're not going to learn as fast as a puppy would, but that doesn't matter. They can still learn and still practice some basic training techniques that will help them stay active, their brain stay active and thinking. Problem solving, like puzzle toys, activities in the backyard. And then of course, very important is to work on nutrition. So we want to set them up to success in their senior life by offering them an appropriate diet for that age, for the specific age. So we want to make sure that once they turn into seniors, we want to provide them a senior diet and facilitate everything, all the organ systems in the body, and especially the brain.
I think everything you're saying makes a lot of sense. And I think that's a good message to make sure that we as general practitioners are relaying to pet owners. I can absolutely understand the feeling of, well, they can't walk as far as they used to, so we're not going to do those walks anymore. And what you're saying makes a lot of sense to say, hey, congratulations, I just bought you some time back in your day because you don't have to go 3 miles, you have to go 1 block now. But still do that. And giving them these types of opportunities to continue to work that muscle, so to speak, and help prevent some of that atrophy. Let's talk about nutrition for a little bit because primarily what I've heard with regard to nutrition when it comes to cognitive decline is we're talking about antioxidants. And when we're talking about antioxidants, are there certain compounds we're talking about specifically?
Well, yeah. So alpha lipoic acid is one that we have data in dogs, and there's data in people. So that's one that we know
So
actually of.
these are, I'm sorry, I got completely backwards there. I'm like, are they, I'm thinking like alpha lipoic acid is being separate from supplemental antioxidants. We're talking about that as the antioxidant.
Yes, yes. So supplemental antioxidants that we probably should be doing, even preventively, is something like acetylmethionine, for example, the good and old SAMe that we all know of and have been using for years as a liver protectant, right? So yes, it's very good for liver function, but that's why it's good. It's an very potent antioxidant. So it does decrease oxidative stress by stimulating brain glutathione. That's what it does in the brain. We have a lot of data in humans, in rodents, and data in dogs as well. So SAMe does have value in preventing probably because it is part of treatment for cognitive decline. So, I don't have the data saying that if we start at a certain age, they're not going to develop the disease. I don't have that kind of data, but we have enough data on how potent of an antioxidant it is to help brain function. And if we start acting on it early, maybe, hopefully, we can prevent early onset of the disease. And SAMe, by the way, interestingly, is deficient in the brains of Alzheimer's patients, in people, in humans.
This is fascinating between the blood markers and, just over the counter SAMe that we're talking about that we've used for years and some of the discoveries that have been made in humans. Gosh, this will be really interesting to see how the data continues to play out for dogs and yes, and like you said, for cats. I would like to know what is going on in a cat's brain on a normal day, not not even in cognitive decline.
Yeah, I mean, I don't think that these, substances, even though they're over the counter, are taken so seriously. I don't think people appreciate how beneficial they can be if utilized accordingly.
I think you're right. I think it almost, not necessarily in terms of SAMe specifically, but words like antioxidants can almost become a little bit like buzzwordy where, oh yeah, sure. It does that really actually do anything though? And yes is the answer. This
Yeah,
is this is doing a lot.
absolutely.
So certainly nutritional intervention, I mean, that makes a lot of sense with early intervention with antioxidants to help stabilize these neurons, making sure that we're not taking away enrichment for our pets as they age. When we do start to get into that more serious set of clinical signs, what other types of treatment options are available for those patients?
Yeah, so if we do have a definitive diagnosis, and we want to, at this point, we have to be a little bit more aggressive with our treatment, there's probably value in prescription medications. And I mean, in the human aspect, there's several, but in dogs, we only have one that is FDA approved, and that's selegiline. I think also known as Anipro. But selegiline is a monoamine oxidase inhibitor that is approved for the treatment of CDS in dogs, and we do use it like off-label in cats as well, but is approved in dogs, and we have data on, its efficacy. So when we use drugs like selegiline, we see significant improvement, like overall improvement in all behaviors, but also improvement in disorientation. So they get, because the disorientation is one of the big signs that we see in the more severe disease process. They also improved in the decreased interactions, so altered social interactions. They get much better at that. It also improves sleep-wake cycle or activity. So they stop, because these dogs tend to change day for night. So they sleep all day and then they want to play at night. So it helps regulate sleep-wake cycle. And also it's very significant in the loss of house training. So animals that are eliminating in the house then stop eliminating, or it helps them. I don't know if it helps them remember where they need to go or helps them signal that they need to go. So that's data that we have with the use of selegiline.
Just my own personal experience, the cases I see where I suspect cognitive decline tend to present more on the anxiety side of things. And I always kind of wonder, like, at what point do I do selegiline versus, sometimes some good old trazodone at bedtime will help, or an SSRI or something along those lines. And so just to clarify what you said there, if we are seeing more of an anxiety presentation, then it's okay to really lean into our more anxiolytic drugs versus the other symptoms of cognitive decline, confusion and house soiling and things along those lines. That might be a case that would be better served with selegiline.
Yes, but one of the things that we need to think first is like, so is anxiety something that popped up today in an animal that is 14 years old, but the last 14 years of its life, it was never anxious before, and now suddenly anxiety kicks in? That's not very normal or very common. Animals that have anxiety later in life have always been anxious, but were never treated, and now anxiety is worse. And it's so bad that it's also causing some cognitive impairments. And then we're confusing things now, right? So this is really bad anxiety that was never treated, but we think it's cognitive decline. So probably not really. Now, for anxiety to just appear at age 14 is very uncommon. So if we see severe anxiety symptoms at, starting onset at really late in life, that's probably more of a cognitive impairment type of disease versus anxiety disorder. Very rarely an animal will develop anxiety really late in life, unless it's the type of anxiety caused by, for example, grief events. So, two animals that have lived together their whole lives, and now they're 12 years old and they love each other, they depend on each other, and one dies. And then one is left behind and they're grieving. And that can cause separation type of anxiety. So that's, we lost someone that was there that we relied on. So that I would say is true anxiety disorder and not cognitive decline. However, we need to remember that extremely stressful situations or traumatic events in life can cause early onset of cognitive decline as well.
Absolutely.
So then the question is, which one is it that we're dealing with and how are we going to treat it? So that's when those assessments are important. Those in-room assessments, like using a validated scale paired with the changes the client is identifying at home, that's what's going to help us decide if this is more anxiety versus cognitive decline.
Absolutely. That makes a lot of sense the way that you're explaining that, where, even if you're presented with anxiety, there's more to it than that, than just, okay, well, let's manage anxiety symptoms. Where did this come from? And trying to attribute a little bit of causality there to help guide our treatment plan in the right direction.
Yes, exactly. Yeah. So you see how that line now is very blurry. It's kind of hard
Sure.
to know which one we're treating. So if we are following them, we have 2, 3 years prior history of what's going on in that dog's life and behavior progress, right? Then I think we have more data to help us. Okay, is this really this disorder or the other one? So that's why I think having those assessments at home with the client, pairing that to your soap every year or every 6 months. And I actually don't think that they should come once a year once they're seniors. They should be coming to you every 6 months because a year is too long in an animal's life, especially an old one. So the assessment should be every 6 months. That's a recommendation by the book, including blood work. So we should be catching up metabolic disorders, endocrine disorders early in life because all of them can actually be correlated with cognitive decline later on. So yes, if we have data from that previous years, we know where we're going with that data. It's easier for us to make a decide which direction we want to go. Now, if we never had data, well, then I guess that line gets blurrier as it goes.
Sure, sure. And then we do our best, I suppose, with the tools that we have available. And conversations like this help a lot to help guide our questioning and get us on the right track.
Yes.
Now, I'm picturing these questionnaires and the scales that we're using in the exam room. And I love questionnaires, but certainly we have a lot available to us these days in terms of, mobility and cognitive decline. And it can be, thinking in a limited time frame that we might have in an exam room,
Hmm.
it can be hard to assess where we really need to focus that conversation for what we have in front of us, maybe during an annual exam where we're kind of looking at everything. To me, it seems like a really good place to empower technicians to say, here's a lot of information. Can you help me kind of sort through what's going on with this pet? And that will help guide our discussion of what we really need to focus on today. I guess the overarching question would be around your approach to incorporating doing better routine assessments for cognitive decline and how we're incorporating that into our workflow.
Yeah, so yes, this is something that we can definitely utilize technician help. The way I do with my patients is I have all of my senior patients already on a reminder for cognitive assessment every 6 months. So they already know that they're already on my schedule. And then all I have to do is make a phone call. So this doesn't even need to be in the room unless they're coming for something else, right? If they're already there, then they're already there, and your technician can do that if that person is trained to do it. And when I say train, it doesn't really require any specific training, but being familiar with the scale and knowing how to word the questions to not fish for results, right? So we don't want to induce the client to give us an answer. We want to be very neutral when we ask those questions and get a true score versus fishing for what we think is going on, right? And that's something that's just human bias. We have to be aware of that. But if the technician feels comfortable asking those questions, they can be done over the phone. It can be just a quick phone call. It's 10, 15 minutes, or it can be done in the room when the client comes in for its vaccine time, its blood work time, or there's something else going on.
Sure, sure. And, to your point, having clients and patients come in more than once a year really opens the door to have these conversations and focus on different areas at each visit.
Yes, and the scales become easier and easier to do each time because then we already know, right? And the client will be the first one to tell you, well, I remember last time appetite was this way, but you know what? Lately it changed. Now, the dog is not eating anymore. One day it wants to eat a lot, the next day it doesn't eat anymore. So it's inconsistent eating pattern, or it's increased or decreased or normal. So the clients kind of already know what to pay attention to. So that's why when it becomes a regular conversation, it actually gets easier over time and less time consuming.
Yeah, and it's like you read my mind right there because my next question was going to be, what about talking to clients about this if they're going, why are you asking me these questions? Or, truly it can be hard to hear that your pet is aging and they are showing signs of cognitive decline. It would be perfectly understandable to maybe have a little bit of denial in that area or just not want to go down that road answering these questions because it can be painful if you're starting to see some trends. So, do you have some good recommendations around how we talk to clients about these, doing these questionnaires, these assessments, and monitoring for cognitive decline?
Yeah, so I think a good way to start the conversation is, instead of just asking these random questions and the client has no idea where the questions are coming from, is to just introduce the topic more organically. So eventually, if all of us live long enough, we're going to end up having some dementia process, right? Like some people are going to have dementia, Alzheimer's. Pets can also have those kinds of things. But if we stay on top of it and we can catch those changes early, then it's easier for us to treat it when it's mild versus when it's more severe. So, it's just you just introduce the conversation in a more I want to say light in a lighter way. And then, so here's this, a scale that we have that you can take home, do it at your own leisure and bring for us next time, or just email it back to us or mail it. I mean, you just offer options, right? Or bring it next time because we want to start identifying these changes. And, most clients actually will do that. They'll go home, fill that out, and either save it or send it back to you. And there you go. You have a baseline. What I like to do is have them do in the room while I'm doing something else. So if you're running your blood sample in the back or you're preparing the vaccines, whatever it is that you're doing, let them sit in the room for 5 minutes and fill that out and give it back to you because that becomes part of your soap. It doesn't take time for them to do it. It's really, really quick. It's just a few theme points that it's easy for them to score, right? They're just assigning a number to a behavior. So, and that's you already planting the seed in their minds. I mean, they're more aware. Those are the things that I should be paying attention to. And you can even give them a free scale, like a second scale to take home and bring it back next time. Now you have something to compare against. So that's kind of how I go about my clients and how I would suggest GPs to do and in their everyday practices.
I love what you said about planting the seed and giving the client some awareness of things to look for. Because, again, that just really facilitates that conversation in the exam room if they're already on the lookout for it. And we have trends and we've been talking about it rather than, all of a sudden their dog is waking them up in the middle of the night and they're like, this has to stop now. And we're starting from zero, working up to it and saying, no, there's more going on here, and they're already aware of that. And also the framing, like you're talking about, really painting that in, I don't know, I guess sort of in a positive light to say, if they do live this long because you're taking such good care of them, then we're going to get some degree of this. So if we're just watching for it early and we can intervene, then there's a lot more that we can do. And, hopefully we do have to intervene at some point because that means they're living this long, full, healthy life.
Yeah, exactly. And that's your opportunity to start changing diets, for example. Yeah, I don't know how many GPs are asking their senior, but what diet is he eating right now? Have you started a senior diet already? Or, so this is an opportunity to start the diet conversation in a very normal, very, positive way.
Yes, usually it's the blue bag that I
Hmm.
get, and you're like, yes, there are lots of blue bags out there.
Exactly. Yeah.
But if we plant the seed, then they know to go look for what diet it is and come back with that information next time.
Exactly. And all of these senior diets that we are familiar with, they all have a handout, a pamphlet that explains what the diet is. So this is an opportunity for us to give them a sample, maybe, right? If we have access to sample bags, is to give them a sample and a pamphlet. So now they're going to go home, they're going to read about it, they're going to start incorporating that diet, maybe half of that and half of the old one, and then transition them slowly to the new diet. So this is when we start the proactive work and start preventing things.
I love that it comes with a pamphlet that they can read through because it can be just a nightmare sourcing information on different pet foods, yet it's something that's so important to so many pet owners. So if we can put that information in their hands, it can take a lot of guesswork out and really empower pet owners to feel like they're feeding their dog something that's going to be good for them, that's going to be helpful and useful in the long run, which is really what so many pet owners want. I mean, of all the preventative care and treatment options that we utilize, nutrition is one that I feel like is just so important to people if they want to feel good about what they're feeding their pet.
Exactly. And I don't think that we are using our senior diets, as effectively as we are using we are so fast to jump into ID and CD and KD and ZD. So we're doing a great job in those kidney diets and liver diets and hydrolyzed protein diets. So we are doing that very well, I think, to prevent or treat other metabolic disorders. But I don't know why we are not so fast to start BD. I wish BD was more popular or just as popular as CD and, ID.
And I will just my own personal experience that I certainly fed BD in my senior dog that I lost a few years ago. And I know the BD is being discontinued and is being incorporated into Hill's new prescription diet brain care plus JD now, in case anyone has an older dog who needs this. But this was years ago, so I probably didn't know to intervene quite as early, but it was still relatively early intervention, and I absolutely noticed a difference.
Hmm. Yes, I notice a difference too, and it is significant. So I think we need to make senior diets more popular.
That is such a good take home message right there. I was just about to say, I could sit here and keep asking questions because I'm learning so much in this conversation about something that we deal with on a regular basis and that pet owners need guidance on. And it sounds like there are a lot of ways that we can be intervening earlier and managing these cases more effectively. So, Dr. Fanucci, I can't thank you enough for joining me for this conversation, like I said, to keep myself from asking a million more questions and be respectful of your time and everyone listening. Are there any final thoughts you want to share with us?
No, I think this was a great discussion. I really appreciate you guys inviting me for this conversation because I think it's a very important one. We need to make cognitive dysfunction a more popular diagnosis, right? In general practice, we need to identify these things the soonest possible, start addressing them while we can still do a lot for that pet and not wait until things are really bad and then the results are gonna, be not as positive as we wish, right? So it's end of life care. It's healthy seniorhood. That's what we're trying to do for these pets that are living longer now because we are taking good care of them by preventing diseases, by vaccinating them. So we do great preventive care. And today pets live much longer than back in the day. But now they're having aging problems, right? That's a consequence of living long. But aging doesn't have to be a disease all the time. Aging is normal. We want to age healthy. And if aging becomes unhealthy, there's a lot of things that we can still do to make that animal's quality of life much better. That's kind of my final message.
I love it. I think that's a great final message and something that we would all, do well to remember that, this is a consequence of elevating the level of care and really taking good care of pets. And so now we go down this road and figure out how to manage our aging pets a little more effectively.
Yes. Thanks for, doing this mission. Like, let's make their senior lives much better than they are right now.
Absolutely. Absolutely. Thank you again.
Thank you.
All right, everyone. Thank you so much for hanging out with me today to talk about canine cognitive decline. I hope this episode helped simplify a topic that can really feel overwhelming at times. I want to say a huge thank you to Dr. Fanucci for all of her time and insight, as well as a thank you to Hills for making this episode possible. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast. I am told that it will help other veterinary professionals like you find this and other great episodes we try to put out there. If you enjoyed this episode and would like to hear more, click on the Education tab on the VetFolio website or find us wherever you get your podcasts. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com, connect on Facebook at Dr. Cassie DVM, or follow me on Instagram at dr.cassie, that's CASSI.DVM. And remember, if one animal is better off because of you today, it's a great day.